Okay, so interventional radiology. I don't know. We're going to find out. Dr. Matthew Dicker, great to have you with us.
Thanks, Sandy.
So you're with Prescott Radiologists, but you're also, that's a part of vascular and interventional specialists of Prescott.
Yes.
So
yes.
you're one of those specialists.
I am. Yes, there's two of us in town.
Okay. Well, I guess I don't really even know what this. What is interventional radiology, Dr. Dicker?
Interventional radiology is a specialty of medicine where we use image guidance to perform minimally invasive procedures. Now, what I mean by image guidance is we use x-rays, CAT scans, ultrasound, and use those real-time images to see inside of people to perform minimally invasive procedures. And by minimally invasive procedures, I mean procedures where there's no big incisions. Usually it's just a little nick in the skin. We can use local anesthetic, no general anesthesia, usually just some sedation. And that allows us to do the procedures with limited risk, shorter amount of time, and usually pain-free.
I'd say that is amazing. Is this sort of new, or has it been, developing for a few decades?
Interventional radiologists have been around for 20 to 25 years. It hasn't really been a subspecialty. It's always been part of radiology.
Okay, and so what's the training for that? A special training, I assume?
Yeah, interventional radiologists are board-certified physicians. We all go through a radiology residency after medical school, which is 5 years. Then we do an additional year of training to specifically learn these minimally invasive procedures.
I love it. So your scar's this big and not this big, and again, they recover, everything's better. So.
Yes.
Tell me this, how can interventional radiology, how does that help people?
Interventional radiologists are consultants to every single specialty in medicine, from your primary care docs to the emergency room docs, surgeons, neurosurgeons, oncologists, gynecologists. So all of those subspecialties of medicine call on us to perform specific procedures. For people in particular, if they have leg pain, especially when walking, that might indicate that they have a problem with their circulation that we can help with. Varicose veins, leg swelling, people have back pain, we can perform procedures that are minimally invasive to help with back pain. Certain cancer procedures we can do, uterine fibroids, fractures in their back. There's a lot of different procedures that we can perform to help people.
Wow, what a difference. And you've got some great before and afters of situations that it's made a difference
We
too.
do, yeah. I think we have a couple pictures we can show some before and after. One of the pictures we have here is of a very dangerous entity, which is an abdominal aortic aneurysm. In the picture we have here, this is a picture of an angiogram. An angiogram is injecting dye directly into the blood vessel to give us an outline of the blood vessel to see what's going on. We see a big bulge on that picture there. That's an abdominal aortic aneurysm, and the risk is that
it can explode. I mean,
exactly,
right,
yeah.
Right.
The risk is rupture, and the risk is death. So this is a before picture, good picture of the aneurysm, and then we have a picture of an after, where we put a stent in, and now you can see that bulge is no longer there and the blood is flowing through that stent, so there's no longer any pressure up on the walls, those thin-walled aneurysms. Now the pressure is all on the stent, so the risk of the aneurysm rupturing is decreased, if not gone.
That is fabulous. And do you have another one? I think you had another before and after, right? Or?
We do. This one is an angiogram of the leg. So somebody had a blockage in the blood flow in the leg. You can see there's a dark line, and that's the X-ray dye that we inject. And you see the interruption. What we're looking at there is the knee, but there's an interruption of the blood flow. That's before, and then after we snake a wire through that area of blockage. Over that wire, we can put a balloon and perform an angioplasty, open up that blood vessel. So you see before, there's that lack of blood flow around the knee. Then afterwards, there's excellent blood flow through the knee. So the blood flow is restored to the leg, and the person can walk pain-free.
All right, that is fascinating. Now, you have a lot of display here, the tools of your trade, Dr. Dicker.
Yes.
And you were explaining some, like, these are stents, I believe, aren't they?
Yes, this is a stent, and this is actually the stent that we use for an abdominal aortic aneurysm. It's kind of this pants leg kind of stent where the blood will flow through the stent and down to the legs and exclude the aneurysm, which is going around the stent. So this is a stent specifically for an abdominal aortic aneurysm.
So it's kind of flexible with a wire thing around it, sort of?
Yes, there's kind of a metallic
exoskeleton
with an inner covering, so the blood can flow through. Not only support it, but the blood can flow through and not flow outside of the stent into the aneurysm.
Amazing.
We have some other stents here. There's a covered stent. So again, you have that metallic exoskeleton. It's very flexible.
And those are inserted into the blood vessels?
Directly into the blood vessel, so the blood can flow through that and keep that blood vessel open.
Phenomenal. Wow.
There's some with coverings on it. There's some without covers on it. We can put them in different locations in
So
the
if
body.
the vein is still intact, let's say, then you'd use an uncovered,
Yeah, well,
that
there's
one,
different
or something,
situations
so-
where we'd use the covered stent and different situations where we
It's okay,
put
you
the
don't have to explain to
uncovered
me. I
stent
guess
in
I
the
shouldn't have
artery.
asked. This is complicated. I
Yeah,
mean,
yeah.
this, I'm sorry, I have to jump to this
Sure.
because this one is so curious to me. What in the world is that,
This is
Dr.
called an
Dicker?
inferior vena cava filter. And what we do is we plant this in a vein in the mid-abdomen. If somebody has blood clots in their legs, if the blood clots would break off and you didn't have one of these filters in, it can go to your heart and your lungs, and it can be deadly. You hear about blood clots, you hear about
yes.
pulmonary emboli. Well, if we implant one of these, if a blood clot breaks off, it'll go and it'll get trapped in this filter, and it won't go to the heart and lungs, and it could potentially save somebody's life having this little spider-like filter inside the
Unbelievable.
vein.
And go ahead, just show me some.
Interventional radiologists, we are IV access experts. So this is something called a Metaport or a portacath, where we implant this inside the body and it goes into a vein. If somebody has cancer and they need chemotherapy and they need long-term IV access, this goes under the skin, and the needle can just go right through the
Wow,
skin.
so they
into
don't
this
have
port.
to keep,
Exactly.
piercing your
Exactly.
arm
Using
or
small
whatever.
IVs, and the chemotherapy can be very damaging to the veins, but this goes directly into the vein, and this catheter ends right above the heart.
And this is a clever one.
Yeah, this is a feeding tube. So we can put this in directly through the skin into the body. If somebody can't eat, somebody can't swallow on their own, this tube goes in, and the nutrition can be
Into the top.
directly into this tube.
And
yes.
this, what is this curious red, white, and blue thing?
This is another type of IV access. This is a dialysis catheter. If somebody needs dialysis, they can get dialysis right through this catheter. And again, this is all under the skin. There's nothing, there's a little bit sticking out, but it's not intrusive. It's not coming out of the neck, and they can get their dialysis right through this catheter.
And is this something that you put in the veins or something? Or
This is an angioplasty balloon where we put this in the artery. If you can see
you
the
can see
balloon,
that right
we
there.
can deflate
Okay.
and inflate this balloon. This goes right where the blockage is. We inflate this balloon,
Blow it up
and it opens up that
and
blood
pull
vessel.
the blue thing out. Amazing.
Exactly.
All of this has to do with radiology, interventional radiology, save
Yes.
people's lives.
Yes.
Fascinating. I learned so much today.
Excellent.
And I'm glad you're around, Dr. Dicker. Thank you.
Thank you
Who
very
knows?
much for having
we
me,
don't know
Sandy.
when we might need something like this. Appreciate it. Again, with the vascular and interventional specialist of Prescott, Dr. Matthew Dicker.
Thanks.